Well, welcome. I am Sue Landgraf. I'm the Executive Director for Cystic Fibrosis Research Incorporated, CFRI, and I'm very delighted to see you here tonight. Those of you who are here in our in-studio and also online, thank you for participating in our 6th season of our Discovery Series. This is program number 3, and then we take a break for the summer and we come back in the fall. We have a very special program for you tonight. It includes presentations by Noel Sanchez of Donor Network West and Elise Elkanen Goldberg, as well as the screening of a recently completed documentary on Elise's journey to transplant. Before getting started, I want to thank our sponsors, Genentech and Vertex, for underwriting tonight's event, and also to additional support from Actavis. We really appreciate it. As always, we urge you to work with your healthcare team. No information presented tonight is for your diagnoses. Please always work with your healthcare specialists. We are not your healthcare specialists. Thank you. Tonight's program is being produced by your CFRI Live team, Scott Wakefield, David Suhu, and Mary Conventa, who is in the back and is fielding questions from our online audience. As always, we encourage everybody here to ask questions because you have your experts present. This is the time to ask those questions. For our online audience, please click in the chat box on your screen and type in your questions. So, is everybody ready to get started? Yes. All right. Well, tonight's topic is of vital importance to the CF community, and it hits home for my family. One of my beloved family members with cystic fibrosis received a liver transplant 18 years ago in May, and without that transplant, she would not be with us today. So we are forever, ever indebted to her organ donor, and we are indebted to all of those who have become organ donors. It's so very, very important, and I'm delighted that we could present this program for you tonight. Well, there's been tremendous progress in treatments and therapies for cystic fibrosis. For many, this progress has come too late. Many times, for many, many people, a double lung transplant or even a liver transplant is their only option for survival. All of us here need to raise awareness about the vital need for people to become organ donors. It is truly, truly very important. Tonight, we are fortunate to have Noel Sanchez with us. Noel is the Community Development Liaison with Donor Network West, an organization whose mission is to save and improve lives through organ and tissue donation for transplantation. We are honored to have you here tonight, Noel, to raise our knowledge and our awareness. Please help me welcome Noel Sanchez.
Thank you for that kind introduction, and welcome to those of you who are here in person, and hello to those who are seeing us virtually. I'm Noel Sanchez, and I represent Donor Network West. And I'm going to give you a little bit of what we do. Donor Network West, we've actually been around since 1987. We used to be known as the California Transplant Donor Network. But as of March 24th of this year, we're known as Donor Network West. We do serve many counties in Northern California, but we also serve Nevada. So we thought that Donor Network West was a new way of actually, a new name, but it's still the same mission. You get an idea of some of the things we do. We do work with 175 hospitals in our service area, 5 transplant centers, and we serve 13 million people. We are one of the largest OPOs in the nation. Our mission is to save lives and improve lives through organ donation and transplantation. And what do? We work in partnership with families, doctors, nurses, and more than 500 funeral homes. This is a transplant community. So as a community liaison, I make sure that we connect the doctors to recipients, because every donation is a generous, powerful gift that can heal and save lives of someone in need. So one day I could be here, and tomorrow I'll be at a high school, at a church, I'll be on television, I'll be meeting with a family that unfortunately was told your loved one needs transplant to survive. And my job is actually to help create initiatives and campaigns to further our mission of saving lives. So I'm very happy to be here today. So today we're going to do a general look at organ donation. You know, there's so much to organ and tissue donation. There's no way for me to do this in this amount of time, but the list continues to grow. Nationally, we're now at 120, almost 124,000, 123,000 waiting, and those in California are 22,000. And you see here a breakdown of those all of those organs that are needed. You see that there's a huge need for kidney transplants, and right now the average waiting time in California for a kidney is 7 to 9 years. We work with a very diverse community, very multicultural community in this state. So when you see some of states that are doing better at donor designations, you will see that California is a very diverse state. So we're working with a lot of multicultural families coming maybe here for a lot of recent immigrants, and we work with a lot of multicultural communities to make sure that they actually get the message of donation when they come. As for lung transplants, you'll see the list is like 1,600 right now nationally, and in California is 200. Unfortunately, every 10 minutes, someone is added to the national transplant wait list, and 21 people die every day waiting for a transplant. If you see this graph, you see that the need continues to grow. The bottom two lines are the deceased organ donors transplanted, and you see the donors recovered. Those were in blue. But if you look at the skyrocket, that arrow that is orange, you see how the list continues to grow and grow and grow and grow. I want to see those graphs kind of like go hand in hand, go up. Just last week in California, we reached 12 million people registered, which is a record-breaking. We're the largest now registry in the nation, yet we still have people dying every day because the pool that we need to, because only around 2-3% of those people that die in the United States, only less than 2% actually are eligible for becoming donors. So you might have died in a car accident, and you were found 2-3 hours later. You have to die at a hospital setting. Organs have to be vented. So if you look at those people, the amount of people that pass away in the United States and the amount of people that actually become organ donors nationally is like 7,000. It's not really enough yet. So we need to really continue to bring the message of donation. So a lot of you are familiar with the arena that is known as Madison Square Garden in New York City. Some of you actually might have been there, either to go see your favorite artist or at a concert, or maybe you went to a boxing match, or you went to the Miss Universe pageant. And this arena actually holds around 18,000, 19,000 people. If you were to put the amount of people that are on the wait list for transplant, where if you were to put them in the Madison Square Garden, you'll need 7 of those in order to fit them all. And I mentioned earlier the 20 people that die every day, the 21 people die every day, and those are who are on the wait list. If you actually take into consideration, this is data presented by Dr. Christopher Berry at the latest Donate Life America conference last year. If you were to take into consideration those who were taken out of the list because they were no longer eligible, maybe they were too sick, they wouldn't survive a transplant anymore, or for many reasons they were taken out, that average is around 30 people dying every day in the United States. That is 22 jumbo jets crashing every year with no survivors. And this figure actually strikes me because you see in the news all those terrible news about, pilots hijacking planes and people dying in it. It makes the news every time. I wonder what would happen if we actually put the faces of those who die every day on the news. Hey, this could be your friend, this could be your mom, this could be your neighbor, your son, your child. It's actually a very striking figure. It's very sad for me. But what do we do? Not everything is lost. Actually, I started with Donor Network West over 4 years ago, and we've actually started implementing a lot of different campaigns that we work in the community. So we used to do a lot of health fairs, like always you see Donor Network West table, you see the Donate Life table. It's April, so I've had over 45 registration drives. We used to do that a lot. But we actually started implementing high school campaigns. In 2011, we started going to the different high schools in our service area. With the Donate Life California has a DVD that I said 11. It used to be 11 minutes. Now it's 8 minutes long. That describes the process of donation. Why is this important? Because the high school students are going to get their first driver's license, and you're going to be asked by law. Question number 7 at the DMV. You'll be asked, do you wish to register as an organ tissue donor? So it's been very successful. We get a lot of invitations back. Last year, I presented myself. There's 6 liaisons like myself, 5 others. I presented to over 2,000 students. So we are getting a lot more traction because the students are going to get their driver's license. We have DMV ambassadors, which are those who go to the DMV to make sure we have our information out. We partner with other organizations. We have hospital ambassadors. Maybe when you go to the hospital, you'll see our materials. You can let people that they know that they can also volunteer to spread the word about donation. If they're too sick, maybe their family members can do that. We do civic talks, we do community talks. And we'll also have a faith initiative. Faith initiative is very important because in a lot of our states, everywhere in our nation, we have communities of faith. So sometimes, in many cases, the person that someone might trust the most is their spiritual leader. Your mom, maybe your first is your mom, your dad, your spouse, but then your spiritual leader plays a big role. So we also have faith initiatives. We go into places of worship, and we partner with different religious leaders and different, not even religious leaders, a lot of spiritual organizations to spread the word about donation. And we have an annual walk. And it is very different that the way we talked about donation. Now we're a lot more in the media. Way more, because in all of our events, we try to let the media know, hey, like this today, streaming, you post it and you share it on Facebook. And the idea is for everyone to take ownership, a little bit, a piece of the puzzle. So I tell everyone of all of my friends when they visit me, their condition for them to stay for free at my house when they visit San Francisco is that they actually have to sign up as a donor if they haven't done that. So okay, let's sign you up. And I think it's like those little conversations, the little conversations have a great impact. And you can't just sit back and say, yeah, all my friends are signed up. I actually make sure that they're signed up, then talk about it. So actually, after I found this chart, this is actually how we're doing nationally when it comes to donor designation rate. The designation rate is individuals that are joining their state registries. All of states, United States now have a way for you to sign up, most of them to the DMV. In California, for example, 98% of those who are registered do that at the DMV. So our DMV partnership is huge. Actually, I found new numbers. Roughly 50% of Americans around the nation now are signed up to be donors. But I think we could do a lot better than that. We are everywhere now, and I will hope to partner with other organizations to actually talk about it, to come up with out-of-the-box ideas on how you can bring the message of donation. Sometimes you hear, I got a call yesterday from a patient who's waiting for kidney transplant, and she told me, hey, can you send me 100 of your new brochures? I've actually been going to the library every other week. I said, what? I've been going to the library every other week. Actually, I'm putting some lawn signs and posters in front of my house, and we're getting a lot of traction, a lot of people talking about it. So I think that we could do even more at the ground level, at the grassroots level, and if you have a connection in the media, anybody that can help, that's great. Oops. And we're still getting some misconceptions. Yesterday I was talking to a group of members of the fraternity Sigma Pi, 40 students, 40 young men in their 20s, and I asked them, what are some of the things that might prevent you from signing up? What are the things that you're most afraid of, or what are the beliefs that you have about organ donation? And most of them, the biggest misconception that they have I hear that in the community a lot, is like the hospital, the ER team is not gonna work hard enough to save my life. Once they see that pink dot, that's it. And it's a big misconception that we have, and we explain every time in our talks that the ER team, the emergency room team, is there to save your life. I have been in cases, and I've seen some people, 10 to 12 people trying to save a person's life. A lot of the times there's nobody has your driver's license on you. Those belongings are not with you all the time. So we explain that you are the priority, and the transplant team is actually separate from the hospital staff. The hospital staff doesn't have access to the donor list. Some people think that the hospital has access, but it's actually the OPO, the Organ Procurement Organization, like Donor Network West in this case. Celebrity status. Sometimes a student asks me, hey, if Lady Gaga is waiting for a transplant, and if you're waiting for a transplant, if she can't afford it, she's going to pay for it. And we see this a lot, not celebrity status, and social status doesn't play a role. And it is against federal law to sell organs and tissues, and we see, unfortunately, we hear news on what's happening in some countries about in organ trafficking, and we get a lot of new people coming into California with those beliefs, or into the nation, thinking that that's the way it works here, that if you're sick, they're going to take your organ. Anyone, regardless of age, can register as a donor, and we've had kidney donors in their 90s, in their early 90s. So if you hear of someone telling you, I'm too old to sign up, you better tell them, hey, I know, I was told that a 91-year-old donated a kidney, so don't rule yourself out. And all major religions in the United States support and permit organ donation. There's no major religion in the United States that opposes donation. They either support donation at an organizational level, or they leave it to the individual. I was raised Seventh-day Adventist, and I thought that was not possible, and then I learned that Seventh-day Adventists, they do have multiple transplant centers around the country. And at UCLA, they do have medical school that permit transplants and do have a transplant team in place. Open casket funeral, a traditional funeral, are honored, not even an open casket funeral, but funeral arrangements that are culture sensitive. I know we work with different communities that they like to wash the body, or they want to send the body to their country after they donate it, or there's a special ceremony that needs to be performed before, or a reading. All of these things are honored. I have a lot of friends who are family resource coordinators within my organization, and their job is actually to provide and facilitate, help the family go through this process, the donor families, and actually honor their wishes before the loved one can donate. And these are some of the faces of transplantations in our service area. Alfonso received a liver transplant. Anthony from San Francisco received a heart. Mackenzie, she received a heart when she was only a toddler. And Claire, she represented a Donor Network West at the Rose Parade in Pasadena, California actually this year on the 1st of January, and she's celebrating her double lung transplant. So it's amazing when you meet these individuals, and you meet them before, sometimes when they were sick, and then you meet them later on. But it doesn't stop with them. We want to perform more transplant, and we want to help more families. We want to help more families look this healthy. And this is it for me. I understand that there might be some questions in the audience, or questions. If you have a question, if you're watching us online, if you have a questions, I have some time to answer some of the questions.
Is this on? Do I need to do it? Okay. With the different groups, I know you're doing recruitment to, you said people come from other cultures and have different conceptions or misconceptions about it. Is there a disparity between who is signing up as organ donors and who is needing the organs?
Well, I can tell you, in the Hispanic community, the largest group waiting in California, for example, I can tell you that's not the case in the nation. But in California, for example, the largest ethnic group waiting is Hispanic, and it represents around 40% of the wait list. Nationally, there is a disparity. For example, in the Hispanic community, we need more than we are doing. But that is changing a bit in California, because now what we see is we might not see a great number of Hispanics registering. For example, right now, the first 3 months of the year, I've only 14% of those Hispanic that donated were first person consent, meaning that registered. But then I look at the numbers, and of those who were approached that were not registered, but they were approached by our team, 78% said yes. So we call that conversion rate. So they are saying yes because of the messaging. They might be a little afraid of registering. But yes, only nationally, I think the number is like 11% of Hispanics are donating, but like over 40% need. So there's a disparity, and it varies nationally, greatly nationally, and in California also varies depending on wealthy you are. The wealthier you are, the more knowledge. Actually, we did a study, and we discovered that socioeconomic status played a big role. The more information that you had, the more money people had, the less stress they had, and the more they could give, which is interesting. The more money you have, the more maybe information you have, the more you give. And then if you are struggling, maybe you're not considering donations one of the first thing you do. So we did do a study and found that socioeconomics play a big role. And that's across the board, regardless of racial group or ethnic group.
Oh, you're so sweet. Thank you. We're so polite here. So I have a question regarding the wait time for lungs in California and nationally.
Yes, so lung transplant, I think you're looking at around 2 years. No more than 3 years. I think you could wait up to 3 years in California. I think because there's less need for lungs. People are transplanted earlier, so we're looking at a 2-year period.
So about a 2-year wait for lungs?
Yeah.
Okay, in California.
Do some families opt, if they have a member that needs a transplant, a lung transplant, to leave the state and go to other states where it's easier to get a transplant? Is that something that's done often?
Yes. So I've known at least 2 or 3 people. So I work with volunteers, and we call them Donate Life Ambassadors. And I did meet a young man he was 25. He had to leave. He moved away from the state and moved states because he heard that the wait list for liver was shorter. Some individuals who could prove that they can be near the transplant center in a shorter time. Let's say that you have a plane, or you have you have a pilot that you can register multiple transplant centers. It's not done that commonly at all, but some people do move states. It's not, most people stay in their state, but I've known of cases that people have moved states in order to get a transplant, and they have to move there and register there. And sometimes service area, because the California Transplant Donor Network, we do not cover the Sacramento area, for example. And I do know of individuals that go to Davis, and they have been able to get listed there in Sacramento.
My question is about, you have individuals who register as organ donors, but what have you noticed with a trend of people are organ donors, but the availability of organs seems to be being less and less, and the fact because of individuals, or a profile of an individual who ultimately becomes a donor, do you notice it being high-risk men, more women? Who are the majority? Because you can be a registered donor, but the question is whether you actually become a donor.
Actually, most of the donors are after 40. They're between 40 and 60 years old. A lot of our donors, the Caucasian community, it's mostly Caucasian, a big number of donors are Caucasian. That varies greatly, again, depending on the state and the region. But also across the board, when you see people registering and donating, a lot of them come from communities that they have access to information earlier. Okay, in some of the states and counties, that means that they might have a better status financially, they're better, they have the information. In some states, the more homogeneous community, if you see a homogeneous community that is primarily Caucasian, you see that is different. For example, San Luis Obispo, I work with San Luis Obispo, the donor designation rates there are over close to 60%. When you go to San Benito County, which is very multicultural diverse, you see that the donor designation rate might be, I think, still in their 30s. So it's access to information, and we did it. We actually hired someone, Dr. Ribel from Pomona University, and we saw that trend.
I have 2 questions online. Is there an age limit for donating organs?
So there's no really, in theory, in paper, there's no age limit. But yeah, of course, if you're older patient, you might not be able, you will not donate all your, you have with your organs, you can save 8 lives, right, with the vital organs, and you can enhance the life of like up to 50 people with your tissues. The older you get, maybe you might not be able to donate 8 organs, but you might be able to donate 1 or 2. Kidneys, for example, and livers. Older people, we see a lot of people donating those because the liver is a very high, strong organ. We have 500 known functions, and it's just a powerhouse. It's just like a power organ. So we see that more in older patients, and we see kidney transplants for older patients. There's no really age limit, so I hear that a lot. Hey, I'm too old to sign up. I usually tell them, don't rule yourself out, because if you're like older, let's say 80 something, and you can't donate a single organ, you can save and enhance many lives with your tissues. Actually, skin grafts are better done with skin from older patients. And cornea transplant, tendons, heart valves, all these things can mean saving a life. So I have a friend in high school, she got burned 50% of her body, 50% at age 16, and her burns were so bad that they didn't even know if she was a boy or girl by the time she reached the hospital. And she received skin grafts to prevent infection, and that could have potentially killed her. So I tell people, hey, don't even, yes, organs are great, but tissue donation, there's also a great need for that.
I have a separate question. With all the different Donate Life organization, is there a recommended way to register? And if I wanted to donate to a loved one, how does that work?
Okay, yes, so the first question, if nationwide, you can go to donatelife.net. So there you can find information on how to go to your state registry, because since registration is state by state, you will have to scroll down, or you have to click on your state. So if anywhere in the nation, you can go to donatelife.net, and you'll see information on each state. Most states have online registrations. They're very differently, they have different interfaces, and all states have DMV registrations. So yes, the easiest way is to go to donatelifeamerica.net or donatelife.net. In California, it's donatelifecalifornia.org. And find out information how to register. Yes, there's one thing called directed donation. So if I learn that a family member of mine is in need, and I'm a registered donor, I can say, I want my Aunt Gladys to have preference for my kidney. But the person needs to make sure that they're compatible first. So you will have to get evaluated and get all the medical blood tests and psychological evaluation like any other living donor. And if you're a match, yes, that person could have preference. I've just last year, if not early this year, we had a case in Salinas, California, in which a donor brother, his brother died, and he gave the heart of someone in the community that he knew. And it was the first, I understand, it's the first directed heart donation ever. And the coach, which is a friend of a high school coach, happened to be a match with his brother, and he was able to donate his brother's heart to him. It is possible, just to make sure that you're compatible. I think
think it's great that your donation conversion rate is so great, up to 80% in those that hear your messages. So are there opportunities to expand those that hear your messages? Have you worked with centers, or what opportunities exist to really expand that message?
So the 78% is within the Hispanic community in the first 3 months. In our service area, Donor Network West area, we are around 45% of those, and in California it's even a little less. So those numbers were for the Hispanic conversion rate, which when you approach at the hospital, you'll say yes. And it's less when you actually do all of the communities, Asian Pacific Islander, Caucasian, African American, is less than that. But it is very important to talk about this because we do see some communities that will not register. They're not registering for some reason, like Puerto Ricans. Like, I'm Puerto Rican, and they're very superstitious. And I was speaking to the director of LifeLink of Puerto Rico that did, last year, and he told me that their conversion rates are up the roof. They're very high because they do say yes at the hospital bed. So even though they don't have a lot of pre-registered individuals, they do get a high registration rate, so conversion rate. So it's very important to talk to family. Like, each of us own that piece. So yes, organizations like ours, organizations like yours, but each individual and each family member needs to know what's going to happen with the family when they die, because if they didn't get around to register, you want them to know what's going to happen moving forward. It's very important.
So within your network, is there any advantage to somebody who needs a transplant being listed at 2 different centers within your network?
You mean network, meaning?
Your coverage area?
So you have to, so most of the people that register at different transplant centers are actually farther away, because here in the Bay Area we have California Pacific Medical Center, San Francisco, and then you have USF, they're very close. Stanford, super close too. So, and each transplant center have their rules as to who to list. So that's not the case in each transplant center. So transplant centers have the ability to deny you based on many factors. Some transplant centers might accept multiple registrations, but most people that actually go out and register different transplant centers, they do that in places that circumstances are different. So, like, shorter wait lists. But they do have to demonstrate that they can be there within an hour, 2 or 3 hours, whatever the transplant center requires. So, so it's kind of tricky. So, but I think people, when they do, there's no preference in that sense. Like, you just have to be sick. You have to be, so kidneys is waitlist, but heart and lungs is how sick you are, right? So in that sense, there's no preference. And it's always who is the sickest, and no celebrity, no nothing.
Anybody else? Questions?
I think there's a question back there.
You mentioned there's no preference, it's who is the sickest. So there, just for clarification, there's no age preference as well?
As who gets a transplant? Once a person gets evaluated, they're not going to tell you, I'm not going to evaluate you because you're this age. You just have to be healthy enough, sick enough to need a transplant, but you also have to be healthy enough to survive a transplant. So the doctor will make a determination based on those factors, and also how sick you are, etc. So, but age, we the transplant people in many stages of their lives, but it has to do with how sick you are. Are you going to be able to survive the transplant? Are you going to be able to continue your anti-rejection drug treatment after you get your transplant for the rest of your life? So those things are taken into consideration, and age might play a little factor on that in that sense, but it's not what really determines it. It's just really how sick you are, and when you get evaluated, you get listed. That's it.
couple of small questions. So Donor Network West is a nonprofit.
We're nonprofit, federally designated to handle the organ and tissue donation recovery process and education in our service area. And there's 59, I think 58 or 59 OPOs, organ procurement organizations like ours, around the nation.
Okay. And the responsibility of the Donor Network West is basically to gather donation, recruiting donations, but you have no influence in listing patients.
No, we have nothing to do who gets listed.
Okay.
Those are determination where the doctor gets the patient gets evaluated, and each transplant center has the ability to reject or accept. And everyone who gets listed at any transplant center in the United States gets uploaded. Their name gets uploaded to the UNOS wait list, which is a national wait list. But we do not have any say on that. We actually manage their organ and tissue donation process. We actually recover the organs, and we check who's waiting, check on the list. We have a placement team, and we also have a community education team, which I belong to. And our job is to increase awareness about donation in the community, but we do not have any say as to who gets listed.
Thank you.
I have one question that just came in. This question just came in. I heard about an opt-out organ donation registration system where instead of registering to become a donor, everyone is assumed a donor, but you register to become a non-donor. Has this been discussed or examined? Is there any chance of this becoming a public policy?
Yes, I know of different countries who have an opt-out system, but with the exception, I don't know if it's Spain, there's only a few countries that are ahead of the United States when it comes to donor designation. Because even if you have an opt-out system, what is happening there is they're saying no at the hospital. So the United States is top 5 in donor designation. So I know Israel is there, Spain is there, the UK, we are there. So yeah, it's been discussed, but that's not necessarily transferring in more donors. And I can tell you, in the climate of the way we do politics in this country, I just don't see how we're gonna actually make that the law. I would love for that to happen, but I don't know if that's gonna really have the impact that people might dream it will. Because I think we pretty have, even with the opt-in system, we do have strong donor designation numbers when we actually compare ourselves to the world. I know. So I really appreciate your time. I know we have other speakers. My information is here, so if you want to reach me via email or you want to call me, I'm more than happy to answer your questions. Thank you.
Wow. That really was quite something. Learned a lot. A very, very important topic, and I think I can speak to for everybody here in the room. It's important to our community, and we've learned some nuts and bolts about the importance of becoming an organ donor. And with our next presentation, we're going to actually deal with somebody's story, somebody who's very dear and near and dear to our hearts, Elise Elkonen Goldberg, her journey for transplant. So before we actually get to Elise, we're going to view a documentary called Spirit, and it was produced by a friend of Elise's, Debbie Coutant. We had the good fortune one day of actually having them come to our office and film, because Elise is a board member of ours and she's also a volunteer. So with that in mind, I think it is time to watch Spirit. And David, if you can get that started for me, I would really appreciate it. And then after that, we will welcome Elise to the podium. Thank you.
Okay, sorry.
That's not it.
That's not it.
No, it's called Spirit.
Nuts.
Down.
Got it.
There you go. Technical difficulties.
Thank you, David.
I
I didn't focus on what I couldn't do. I tried to focus on what I could do. What our normal is not what normal really is. My mom had an intuition that something was very wrong. At 3 years old, I was officially diagnosed with cystic fibrosis. I would live to be 7, 8, 9 years old. Both of them took it as a mission that that's not going to happen to our child. I was never told that I couldn't do things because of my cystic fibrosis. I would never let friends see what I had to go through behind closed doors. CF is not an attractive disease. You have to spit out very gross stuff. I planned my day in a way that I would say I wasn't available until noon, and I think people thought I was a lady of luxury. We tried to make my treatments enjoyable, so I would either have the television on or I became a real Facebook junkie. Pregnancy at that time was considered a very big risk for women with cystic fibrosis, and one thing I'm not is a risk taker. I want to live. Ultimately, we chose adoption. My health was a big component of the challenge in that adoption, whether or not I would still be alive to raise my daughter. 3 years later, an opportunity became available for us to consider an international adoption. The travel challenges with having CF were enormous. My daughter now is 21 years old and my son just turned 18. I vividly remember getting in an argument with one particular physician. He said to me, "Why can't you just go lie on a beach somewhere and just relax? Why do you need to go into the high altitude and go skiing?" And it was, no, this is what I want to do. And so I did it. My health started to take a steady decline about 10 years ago. The amount of time I started to spend at Stanford Hospital, which I also call a spa, went from once a year to 3 to 4 times a year.
I met Elise in 2010 when I first started this job as a cystic fibrosis social worker. Immediately I saw that she was just kind of a different type of person. Has a deep soul, is very thoughtful, and managed her disease in such a way that was kind of unique, different from other patients.
When I was at the spa, my private side really came out, and I most often made the choice to not have people come visit me. At that point, I was on oxygen, and that was a very significant shift in my life when one could see something on me say that I was not a well person, and I struggled quite a bit trying to go out in public with my oxygen tank, who I named Olivia. I finally decided that I just needed to go out and do my thing. I said to myself, it's showtime. One of the most wonderful support systems that I have is my family. They never made me feel as if I was a burden, and I had to have been one. One of my physicians brought up the subject of transplant. I never thought I was sick enough for that. The catch-22 is you have to be sick enough to need a transplant, but healthy enough to survive a transplant.
When Elise got the call, we had just arrived to play Maj.
My cell phone rings, and on the caller ID, it says the transplant clinic.
I started kind of instinctively rubbing her back.
She said, take a deep breath, it's all going to be okay.
It turned out to be the call.
And she said that we have a donor set of lungs for you if you're willing and ready to accept them.
The chaplain, Bruce Feldstein from Stanford, came into the room.
Bruce asked if he could lead a gratitude ceremony. we all shared what we were grateful for. I remember thinking that I was so grateful for this individual who would become my donor and my donor's family. Up until the very last minute, I was still in denial that I really needed this transplant. And as I hugged and kissed my husband goodbye, I whispered in his ear, "Are you sure this is really the right thing to do?" He said to me, "Elise, yes, absolutely." And so I went in with a thumbs up. They immediately asked me my name, my birth date, and why I was there. So my response was my name, my birth date, and I was there for rhinoplasty, breast augmentation, and a double lung transplant. And the nurse didn't miss a step, said, "We need to call in plastics." I'll never forget that first breath I took after they took the tube out of my throat. The most amazing feeling came over me where for the first time in probably 25 years, I didn't feel my lungs. There was a clearness that was there that I almost thought my chest cavity was empty. It was seriously like a dream. My life today is a 180 from where it was 17 months ago. I have a freedom in my life and the ability to be spontaneous like I've not been able to have since I was probably a teenager. I have 7 to 8 hours of my day now that are freed up from having to do treatments. Life sometimes deals cards you just don't know how to deal with. One of the greatest pains I've had in my life, and it's something I never ever could have anticipated, was outliving my mom and my younger brother. I wish I hadn't had to do that for both my mother and my brother. And I really haven't found the meaning for this all to have happened the way it did, but someday maybe I'll figure it out.
We actually handpicked her to become a mentor for our mentoring program at the hospital. So she's been mentoring another CF patient for the past couple of years now. And that patient has done much, much better because of Elise's influence.
There was a period of time after my surgery that I had to redefine myself. And that was actually something that I talked a lot about with people in the CF world is, where did I fit? I wanted to pay it forward, and I've been doing that by volunteering at the Cystic Fibrosis Research Inc. On September 17th, 2014, I had my first lungversary. I got many, many happy first birthday cards. And it was really a joyous celebration. And in honor of that, a group of us did a 5K nighttime walk run. People always ask me if there's any ways I've changed because of having another individual's lungs in me. This person must have been a very, very early riser, as well as a really good burper, because I have never burped like this in my life.
In April of 2014, Elise, our friend Beth, and I did a half marathon together.
We all thought it wasn't necessarily the greatest idea. We didn't think she was ready.
One of the things that we started doing together was knitting, and our team for the half marathon was called Close Knit Friends.
When we got close to the finish line, we all grabbed each other's hands and we did a little jog across the finish line, and it was like, wow, we did this.
I haven't yet come up with an idea, but I'm sure it will be something special.
Now I've just taken this off. I tell you, I've seen that documentary several times now, and I always cry. It's an extraordinary journey, and what Elise has been through and what others who are facing transplantation go through, what their families go through, is a journey that none of us want to ever be on. But when somebody does receive that transplant and they come out of it in the shape that Elise has and is able to give back to her family and to her friends and to the community, that's something to be so very, very grateful for. And I would just encourage everybody, before I bring Elise up here, to become an organ donor if you have not already done that. And so with that in mind, Elise, it is now your turn to come up and share your story, and we are so pleased to have you here tonight. We always have technical difficulties. There we go.
Thank you, Sue. I'd also like to thank Debbie Coutant for this is weird. Okay. I push it back a little. For the honor of her asking me to be the subject for her documentary. She would have been here tonight, but she's at the Giants game. So I want to tell you a little bit about me to supplement the film. In January of this year, I celebrated my 56th birthday. And the most common questions that I always get are whether or not I must have a mild form of cystic fibrosis, and why has the course of my CF been different from the norm? Well, whether I want to say I was lucky or not, my CF genotype is indeed a double delta F508. And why has my course been different from the norm? What I believe is it has partially to do with my early diagnosis. I was diagnosed at 3 years old, and I grew up in a family where my father is a physician. He's not a pulmonologist, but he is a medical doctor. And I had early access to medical care, and I learned early on how to navigate the medical system. I also have always been compliant. I early on had to sleep in a mist tent, which they no longer do with children. I also, when I had exacerbations, my father would do my chest percussion therapy, and he'd always tell me stories, and we made it a joyous experience versus something that was, we were never fighting over. It was something I looked forward to because it was story time by my dad. The other thing is I come from a very athletic family, and very early on, I was a skier, an ice skater, swimmer, tennis player. But I looked at athletics as something fun, and it was family time. It wasn't something that was drudgery. And I grew up, luckily, to be that way as an adult, and I truly believe that that kept my lungs clear and healthier over time. And last but not least, I have to put in that I think there's a bit of luck. To have lived this long with I've got to do this. Okay. Okay. So there was a turning point, and that was Thanksgiving 2013. I caught RSV, which is a respiratory virus, which causes one of the side effects of RSV is bronchiolitis, which is an inflammation of the small airways of the lungs. For me, that was a complete game changer. I was trying to stay ahead of the game. My respiratory treatments increased from 3 times a day to 4 times a day. Oxygen became my friend. I was told the more I wore it, the healthier I would be, so I was optimistic I would get off of it. I also tried to continue with my exercise. As you can tell in this picture, this is the day when my husband took me out hiking with Olivia, and it was the hardest hike I ever did in my whole life. It was the last hike before my transplant as well. I also tried to keep up with good nutrition, avoid people with colds and flu, and I tried to stay positive and optimistic that I would ultimately get back to my baseline. My favorite physician would say to me I had to be a patient, which wasn't very easy for me to do. Ultimately, despite all of my efforts to improve my lung function, my FEV1 continued to decline, consistently under 30%. And in May of 2013, my CF physician asked me if I would consider talking to the lung transplant team. As we've heard earlier, there is this 18-month window that you have to be sick enough to need a transplant, but healthy enough to survive the surgery. And ultimately, the physicians believe that if you didn't look into transplant as an option, you may not survive past 18 months. Pre-transplant evaluations vary from center to center. I specifically had to go through these exams: a 6-minute walk, a blood gas, a colonoscopy, a gynecological exam, a lung CT, a heart catheterization, mammogram, and GI tests. And all of these tests are done with intention. Their hope is to rule out that there is no underlying disease that would be contraindicated for you to be able to survive a transplant, as well as if there's any underlying cancer that might come out, because when you're immunosuppressed, cancer literally blooms. So in June of 2013, and I realize after your talk, I was very fortunate. My weight was short. A lot of that I know to believe is I slid down very, very rapidly. And something that I'll discuss about a UNOS score. My score when I was listed was 37.88. And the weekend before my transplant, because of the increased need in oxygen, my severe drop in my pulmonary function tests, and my overall health status, it climbed up tremendously. And ironically, it was Monday of that. This was a Friday. On Monday, I got the call. But what I was told was, when I was listed, was that my surgery would be a clamshell versus a sternectomy. And a clamshell procedure is a more standard procedure for people with CF, because the way the incision works is it comes down from your armpit to underneath your ribs, across your chest, and up under the other armpit. And you're literally opened up like the hood of a car. And the reason for that is CF lungs tend to have adhesions, and they need to really clean out the lungs, get out all of the infection, and have a good viewing area for the doctors. The other option is a sternectomy, where they crack you right down the middle of your ribs and open you up, sort of like a book. And I was told I was having a clamshell. And the other thing was, I was told that potentially because of my size, it was going to be a longer wait for me. So the waiting period. You must be available 24 hours a day. You're expected to be at the center I was listed at within 4 hours of being called. During that time, I did travel twice, and I went to my father-in-law's 80th birthday and a family reunion that was at my father's. When I traveled, you go on what's called status 7, which takes you off the list because I was more than 4 hours away from my transplant center. This is not something you take lightly. You don't go off traveling to Hawaii, and it's a time when you really, if you're serious about your transplant, you want to stay close to home. But I have to tell you that one of the hardest calls I ever had to make was when I got home to re-put myself back on the list. In fact, ironically, when I went to make the call, the transplant coordinator called me first and wanted to know if I was back in town. And I fell apart. I was so nervous and so anxious about this surgery that I said to her, I just don't know if I can do this. And she was so patient with me and explained, this is up to you. It's not up to us. You can stay off a day, a week, a month, but the longer you stay off, the further out you're pushing ultimately this transplant. And because of the time and patience she spent with me, I did go back on that day. But I honestly felt after our trip I was too well to be on the list, even though I was on oxygen and everything else. So I continued to try to kept up my treatments. I tried as hard as I could to do exercise, but my activities were very, very limited. The other thing I did was I organized items to take to the hospital. I made Ziploc bags underneath in a cabinet of the personal items that I wanted to bring. And one item that was very important, and I'm glad I packed it, is pajamas that button down the front, because you are constantly being exposed, and that's the easiest way for access. The other thing that I did do was set up a Caring Bridge, which is an online social networking tool for connecting patients with family and friends. And the reason that we did this was I wanted to take the pressure off my husband as the key focal point from text messages, emails, phone calls. This way, my two caregivers, Beth and Elisa, were getting daily updates from Craig, and they were able to post how I was doing after my surgery on a daily basis, sometimes multiple times during the day. And then the wonderful thing was I was getting messages back from people encouraging me along my journey, which was really, really welcomed. The call. So on September 16th at Mahjong, which is a game I love to play, the call came in. And I had had a plan. Because I knew the wait was going to be long, I was pretty relaxed about thinking I have a lot of time, and I drafted up an email that I was going to share with friends and family about this journey I was on. Because it wasn't something I was publicizing that I was going to be getting a transplant, but I decided this is the easiest way. I'll distribute it, mass distribute it. And in the email I wrote that when I get the call, I'm going to put on Facebook Code Purple. Little did I know that Code Purple has many different meanings, none of which is a good thing. It can mean there's a lost senior citizen in the hospital. It can mean there could be a bomb in a hospital. So the messages that were coming afterwards about, Lise, where are you? What's happening? It was quite comical. In hindsight, I probably shouldn't have done that, but I picked purple because that's the color for CF. So Elisa helped me pack and dash, and then in the car I realized that I hadn't called the most important people I should have called, who were Craig, my children, my father, and my father-in-law. So you rush up to the hospital, adrenaline, I have to tell you, I was breathing the best I'd breathed in months because the adrenaline is just rushing through your body. You get there and it's hurry up and wait. As was noted in the movie, we had this wonderful gratitude ceremony that was held by the chaplain, and my caregivers and their husbands were there, and we were just all talking over the afternoon. But nothing medical was going on for the most part. They just kept coming in saying, you do understand this could be a trial run. And I kept thinking, okay, if it's a trial run, then I'm learning something. Deep down, obviously, I really didn't want it to be a trial run. So at 10:30 p.m., I was wheeled into pre-op and get in there, and you heard how I entered in there. So the most important call came in at midnight. The nurses and the anesthesiologists were so casual. They're talking to me about all kinds of little things of which I really didn't want to talk about. I was very focused on what was the task at hand. And I kept listening for the phone calls, and little things would be coming up until finally the anesthesiologist says, wonderful, gets off the phone and says, it's a go. So that's the last thing I remember. And so surgery typically takes 6 to 8 hours. Mine lasted 7 hours. And I ended up with a sternectomy and 4 chest drainage tubes. So just to recall, that's your incision right down the center of you. So recovery begins. And I have to say that this was the point in time that I was waiting for from the moment I was listed. I couldn't wait to start my recovery. The time in the ICU varies from patient to patient. I was transferred to the mid-ICU where I stayed until I was discharged 24 hours after surgery. And I have to say there's no rest for the weary. They get you up and out of bed, and you have to be in a seat, and you've got sternal precautions, so everything you're doing, you can't use your arms. And I will say pain management was very good, but it was just constant. And my husband, who pushes a little bit, is, you gotta get up and walk, you have to get up and walk. So first, I think it was the third day, walked to the room next to me, then it was the end of the hall, and before I knew it, I was walking the halls with my children as they're both carrying the containers that held the drainage out of my chest. And that hill, which I had done on many, many occasions as pre-transplant, I used to call Mount Everest because it was so hard for me to walk up that part of the hospital. And I'm looking back going, I can't believe I'm just walking up this and talking the entire way, mind you. So one of the most important things about post-operative care of the new youngs are immunosuppressants, antibiotics, antifungals, sulfa antibiotics, and antivirals. Compliance and adherence is essential. So, unexpected outcomes. Surgery has many risks, and outcomes vary from individual to individual. My transplant and recovery was relatively easy. The only thing, and on the scale of what could possibly happen, this was very minor, but I did sustain an injury to my brachial plexus nerves on the right side of my body, affecting my arm and my hand. And over the last year and a half, I've been doing physical therapy, and I am regaining function of my hand. But as I said, in the scheme of what could have gone wrong, this is minor. So the best part was coming home. It's essential that you have a strong post-transplant support team, and that is formed before your transplant. That you meet with your caregiving team and the psychologist through the education sessions that you go through after you're listed. You have to have 24/7 for 3 months. It's mandatory to have one of your caregiver team with you at all time. So you're basically being babysat continually. My husband was lucky to be caregiver, chef, and driver. And I have to tell you, he did an amazing job. I credit him for my very rapid recovery. Close friends stepped in when Craig was unavailable. So I have a whole new routine. No more respiratory treatments after 35 years. Supplemental oxygen is a thing of the past. I am committed to the transplant team for life. Appointments initially were biweekly, and I'm 19 months out, and I'm finally at 3 months apart. But I have to say, you get a little anxious when they push you out further, because they're like your lifeline. I wear a mask when I'm in crowds, on airplanes. I always have it in my purse, so if I get concerned, I put it on. I stay away from all individuals with colds and flus. And I'm on immunosuppressant medications for life. So there are some limitations, but I have to say that I want to point out the benefits outweigh any of these limitations. Only to name a few, one of which is my favorite, there's no more sushi. You can't eat raw fish, pork, beef, or eggs. I'm supposed to limit alcohol beverage. I'll say that I have a glass of wine every once in a while. You always need to wear sunscreen because your risk of skin cancer increases tremendously post-transplant. And one thing that I really did enjoy and I cannot do anymore is gardening's a thing of the past. So life after transplant. People think I'm cured of CF, which is not true. There are still parts of CF that need attention. They are sinus disease, reflux, DOS, yes, we're still prone to bowel obstructions. Diabetes is actually worsened after transplant because you're on chronic prednisone. And osteoporosis is a result of being on all of that prednisone, so ultimately you're also at a higher risk for fractures. But I want you to note the 100 on the pulse ox. That was pretty exciting. So wishes do come true. The one thing that I really wanted to do before my transplant was to see my children off to college. So I launched my daughter this fall in Boston, and just 3 days ago, my son, husband, and I came back from colleges he has been admitted to up in the Northwest, and also that I am able to walk and walk and walk now, which is wonderful. So I'm doing lots of celebrating of life, going on hikes, going kayaking. I've become very spontaneous, and friends say you never sit still anymore, which I used to sit still a lot more, and celebrating my first lungversary. So I'm looking forward to the future. I've set my hopes high for a healthy and wonderful future. I'm looking forward to seeing my children graduate college, have careers, and get married in that order. Enjoying grandchildren, traveling with my family, my husband, paying it forward with volunteering at organizations, and most importantly, each and every day being grateful and thankful to my donor and my donor's family. Thank you.
It was amazing. Does anybody have any questions for Elise or comments? You're amazing.
Well, I had a lot of help.
Had a sternotomy?
Why I had a sternectomy? I want to say it's because the thoracic surgeon that Craig and I met with initially, I said to him I wanted the procedure that was the easiest to recover from and the least painful. He told me what it was, and I said, will you make note of that on my chart, please? And I only lucked out that there were, I think, there's 7 surgeons at the hospital I was transplanted at. I lucked out. He was my surgeon, so he remembered. In fact, that was the first thing I asked Craig when I woke up. Very first thing out of my mouth was whether I had a sternectomy or clamshell. It wasn't, hi, I love you, or I'm alive. It was. So I don't know whether it's really easier to recover. But it is what it is. The other one I realize now wouldn't show a scar constantly here, but it's my badge of courage, I guess. Any other questions?
It's actually a leading question. Are you an organ donor?
I am. Yes.
And I ask you that because many people know who I'm referring to, but a dear friend whose daughter was waiting for transplant, very petite, like you, which of course increased the weight because of the small lungs. And she ended up being one of those people who was listed and then fell off the list because she was too ill to survive transplant and passed away. But she herself was a donor, and her family felt, she had expressed very strongly to her family, and of course they are very supportive, that she would want to be a donor. And so I really appreciated what you said, Noelle, because there is somebody there who benefited from her tissues, and they've received the letter from the person who received her kidney. And so I think it's this amazing gift that just keeps on giving. And so that's why I ask you. It's just incredible to know, all you've been through, and yet here you are, you're also stepping up and identifying yourself as a donor. That's beautiful. Thank you.
So I have a question. Were you transplanted too early?
No, but I
didn't think so, Cleopatra.
I think I'm in good company when I say that those on the list, we all think we're not sick enough. We're not sick enough. But now that I see the other side, I realize I was being ridiculous. You're on oxygen. You had no life. But I think it's a common thought that runs amongst people. I'm not sick enough for this. And that's probably a lot the fear factor. It's scary. But when it's over, it's wonderful, but it's a journey.
And what a journey.
Yes.
Thank you, Elise.
Okay, thank you.
Wow, that is quite a story, and I'm pleased that all of you could be here tonight to share in Elise's story and to meet Noel, and hear about the good work that he's doing and the urgent need for everybody to be a donor, because it does mean life for somebody else. It's a huge gift. So thank you. I'd like to thank Vertex. I would like to thank Genentech for being our sponsors tonight, and I'd also like to thank Actavis for stepping in and providing some additional support. We appreciate everybody being here tonight, and we look forward to seeing you back in September, because we do take a break for the summer. So the next CF Discovery series will be Tuesday, September 16th. Yes. So thank you and good night. We appreciate you all being here. It was a really wonderful evening. Thank you for sharing it with us.